Hi everyone, I'm Joe. Today I'm going to be talking to you about the application of a vented chest seal and an occlusive dressing, and also we'll be going over how to burp the occlusive dressing. Step 1, we're going to inspect the thorax. Once you notice that there's a thoracic injury, peel open our occlusive dressing and remove it from its package. And if you have a 2x2 or Acrylex, wipe away the blood away from the side of the injury. Apply the vented chest seal or occlusive dressing upon exhalation. Reassess. Be sure to log roll your patient and check for a downside wound. Inspection of a downside injury, wipe the area away and apply an occlusive dressing. For demonstration purposes, I'm going to be applying the occlusive dressing on the downside injury. And again, apply upon exhalation. And reassess. And that concludes the application of the vented chest seal and the occlusive dressing. Now we're going to talk about burping the wound. Upon reassessment, if you notice any clots formed or any increase in respiratory difficulty, to burp the wound, simply peel back the chest seal, clear any clot away from the area, and reapply the chest seal upon exhalation. After burping the wound, we're going to continue to reassess our patient. We're going to monitor for the development of a tension pneumothorax and document all care on a DD Form 1380.